And this segment is sponsored by Springfield Clinic. In the studio this morning on this Wellness Wednesday, we have Dr. Solmaz Bauk. Good morning.
Good morning. Thank you for having me.
Yes, of course. And this morning we're talking about the importance of physicals. We all know this is something important that everybody needs to get. Talk to us about it.
So a lot of times we call our doctor when we have a new problem, a new concern, and that's usually why we go into the office. But I think it's important to kind of touch base annually, see your doctor once a year, get a new kind of basis set so they can go over risk factors that may be affecting your health, go over any changes that happened in the last year, update your medical history.
Now, how long does a physical usually take? Because some people may feel like, you know, I don't have time to go to the doctor, or, you know, it's just you're in the office all day. How long does the process really take?
Really from like start to finish, coming in, getting your vitals and everything, and then doing the actual exam and talking, probably half an hour.
Okay, see, 30 minutes. And then, you know, just there's always some cases where you go in and get a physical and you find out, you know, something is really wrong with you. Have you seen that happen?
Oh, a bunch of times, yeah. I come in and you're just kind of going through the routine of going over medication lists, family history, and you kind of catch things here and there and see interactions between things that maybe need to be looked over.
Yeah, and speaking of family history, I know that's something really important that, you know, things can be just passed down from generation to generation. Talk about the importance of just knowing your family history when you come and check on that physical.
Yeah, that's one thing I always go over with my patients. Is there anything new that happened with your family, anything you want to update? It's great to know if there's a big cancer history in the family, any autoimmune diseases, because that can put you as the patient at a higher risk. So it's something that we just want to go over because there's preventative healthcare measures that we can take part in to kind of catch those things early on.
Yeah, now when you're getting a physical, do you usually have to get a shot, or is that just for like the younger kids when you go in nowadays?
We always go over your immunization records with you, and if you are up to date, then you're good to go. If there's some things missing here and there, then you may get a shot.
Yeah, I'm not a fan of shots. I used to hate getting shots as a kid.
I understand.
Yeah, and then, you know, also with physicals, you know, it's just so important, especially for the new babies and the elderly. Talk about, you know, parents who just, again, they may not have time, or, you know, they may be super busy, but those newborns and especially those younger kids with germs going around. Talk about that.
Yeah, so little pediatric visits, they're pretty quick, so they're not really time consuming. So coming in, you kind of do them, there's a timeline of how you do them, you know, the newborn, the 2-month, the 4-month, making sure they're up to date on their shots, looking them over head to toe, catching if there's any concerns. And a lot of time it's a great time for the patients to ask questions, the mother, the father to ask questions if they have, and a great time to just get resources.
Great, some great advice. Thank you, Doc, for being here.
Thank you so much.
Make sure you get your physical. All right, thanks for being here.